Welcome to Talk Girl 60 KTRC. This is Dr. Daniel Rennell. You're listening to The Humanity Behind the Vanity, a reality show about plastic surgery. I'm here with my wife, Betsy Rennell.
Hi there.
And this week, what are we going to do this week?
We keep promising people every month we're going to do their emails, patient and listener emails, and we neglected to do that in January. So here we are for February.
Okay.
Listener emails,
Okay.
people.
Yes.
Okay, and you
I
want
also want to
yes.
I want to say in the month of March we're doing another Vanity for Charity month, wherein all the profits from Botox and other fillers,
right.
all the profits are going to go to a charity. And this month we've picked a small local nonprofit school.
And we're not allowed to say their name because they don't want to
Right.
Use it in this way,
Right.
although they have accepted our offer
Right.
to donate to them.
We've donated to Adoption Agency in the past and other schools in the past
And the Espanola Animal Shelter,
Animal
always,
Shelter,
and they're
of
coming up
course.
soon too.
Right.
Yeah.
So in the month of March, I'm going to discount my prices significantly.
To entice you to come
get you to
in so
come
the
in.
money can go to the school.
And all the money will go to the school. Yes.
We don't get a penny of that section of the money. And
Okay.
if you guys are really supportive, we always can give a lot of money away.
Right.
And it's only because of you guys. So please, if you were thinking about it, never tried Dr. Ronnell before and want to try him for the first time, haven't been in a while, want to come back, it's going to be deep discounts. We want you in. It does not go to our pockets. It goes to this school that
Right.
so needs it and is so
Right.
worthy of it. So
Right.
please come back, come in for the first time, keep coming. And
Yes.
wait till March to do it, so we
Right.
can give so much money.
Right. And
To
I just
the
bought
adoption agency,
Yes.
we gave about, what was it? How much money did we give?
a lot.
It was over $10,000, and that's all because of the listeners and his patients and their friends, and so God bless each and every one of you,
Right.
because that went to an adoption agency here in New Mexico.
And I just bought a big stock of Artifil.
Whoa, come on in, girls,
Yes.
boys, come on in, it's my
And,
favorite.
Right. So, which reminds me, thank you there. Artifil is helping to sponsor this show.
Yeah, they're in town, we had dinner with them
And,
last night, in
mhm.
fact, yes, fun dinner.
It was good. Okay, so let's do our listener emails.
Get on with it, all right, I'm ready. Ready?
Okay. Yes.
Are you ready?
I'm ready.
I'm a 31-year-old nurse and have some fairly severe stress lines on my forehead, don't we
Right.
all? I would like to get some collagen injections. Thank you.
Okay. Collagen injections are really not always the answer for forehead stress lines, and that's why I wanted to talk about what do you do for the forehead.
It's actually, can I just interrupt for 1 second? It's
Yes.
actually great because I get a lot of other mom friends that I have who are like, now what's the difference between Botox and a filler? I have this line I want to get rid of my forehead. So
And if you
girls,
let me, I will
listen, I will,
explain.
I'm going to let you know. It's just so apropos. Okay.
So the forehead has a bunch of muscles in it, and the muscles of facial animation are attached to the skin. And so when the muscles contract too much, you get these wrinkles in the forehead. And there's two patterns. There's the straight up and down, the 11,
I hate
right in between the eyebrows, and then there's the ones right across, the transverse ones.
I got a
And
71.
they're,
Oh, sorry.
And they're caused by different muscles. And so the way to treat them is not always filler. First, you got to figure out the anatomic reason for what's causing it. And usually it's an overactive muscle. So you got to weaken the muscle, and that's Botox. That's where Botox comes in. And soon Dysport. I'll give a talk about Dysport soon, as soon as I start to use it.
Yeah.
But you got to weaken the muscle first. And then, if you still have a deep furrow or wrinkle, that's when it's a good idea to put in filler. Because if you put it in early, even before you treat the underlying reason, which is the overactive muscle, it might be a waste of money. It might not do anything. And so, yes, there are plenty of people who are candidates for both Botox and filler, but I almost always think it's a good idea to start with the Botox for the forehead wrinkles. Now, I don't like to eliminate all expression from the forehead, and Botox has got a bad rep because it leaves, it can leave you looking paralyzed and devoid of expression.
That's just what the patient asks for and what the doctor's willing to do.
Right,
I mean,
and that just depends on how much you use. And I
Yeah.
personally don't like to do that because I think you need to have some expression in your forehead.
I don't agree.
Right,
I like
Betsy
to be
loves
wiped
having
out.
a very, flat, forehead that doesn't have very much expression. But you are extremely expressive with your eyes and with your cheeks and your
So
lips.
it's fine, but I want to
So
look in
it's
this continuous state of shock
Right.
all the time.
That's just you for your forehead. I mean,
Right.
there's some people who don't move their mouths when they talk, and it would be a mistake for them to really, weaken the muscles of facial expression because then they look like zombies. So,
Right.
but anyway, so that's the story with the filler. And I always like to bring people back 2 weeks after I give Botox to see if it worked, to see if they need a little more, and really then to see whether the filler will work. And there's lots of different fillers. There's Juvederm, there's Radius, and there's Artifil. There are others out there, but I like those three because they have different qualities. They each, the Juvederm lasts about a year, the Radius about 2 years, the Artifil about 4 years, and they're priced differently. They're priced accordingly. As a matter of fact,
Explain that.
Right. So for example, a syringe of Juvederm is about $600. A syringe of Radius is about $800. A syringe of Artifil is about $1,200.
So the higher the price, the longer these things
longer
last.
it lasts, right. The second syringe of each of those costs less. If you look at a 5-year length of time, you'll actually spend less if you get Artifil, because you won't need as many touch-ups of the other ones. If you're coming back every year to spend $1,000 or something on Juvederm, it adds up. Whereas with Artifil, you're really not spending that much for touch-ups because it lasts so long. But this is a discussion I like to have with each individual person because you have to take into consideration other things besides money. It's also
Time.
It's time. It's whether the filler will work where they want it to be done.
It's also there, like for me, I've said this many times, Radius, I love it, but I don't get the lasting result from it that other patients do get, whereas for me, Artifil has worked beautifully, but what I require for what I want, this is just me personally, because I originally started out with a very flat face, I require many different, not many, but...
Right, and for example, you can't use Radius in lips because it's white. If you want lip augmentation, you have to use Juvederm or Artifil. Which reminds me, we have a new phone number. It's 988-8886. So if you want to talk about it, you can't call the old phone number because it's not going to work.
It doesn't work, people.
We got a new phone number.
Don't you mean a forwarding thing, though?
It'll be a live person forwarding because that number will still be answered.
Oh, I see.
But 988-8886. And I got to think of something funny with that. But that's our new phone number.
It's a good phone number. Maybe I can remember that. Goodness.
Yes.
So when you want to come in for March to donate your money, 988-8886. You want to come and talk about filler or anything else? 988-8886.
And thanks to their Santa Fe reporter for generously running some ads
Yes.
about this.
They've done awesome PSAs.
Right.
So if you want to have a piece of paper with this info on it, check out any Santa Fe reporter in the next few weeks.
Right. All right.
It's in every week.
We've got to wrap this up already.
Well, fine. We can continue after our tip from Marion.
Next is a tip from Marion Urban.
Yeah.
Skincare tip. And thanks for listening. We'll be right back.
Cool.